So like, what happened to you guys? Napping, low back pain, anything?
For him.
Oh, for you?
For him first.
Oh,
Yeah.
okay. So you don't have any problem, it's just you?
I have, no, I already done my...
Okay. And then, so how about...
For shoulder.
My back pain.
Low back pain?
Yeah. I think this is something.
His scoliosis.
Oh, okay.
And the shoulder also.
I already had my X-ray before, 20 years ago, and there's a slip disc and a lumbar.
I see. Oh, okay. And then, so since you work on hospital, like, did you go to MD medical doctor? Like, what did they say anything to you? What do you do? Like,
No, before the Philippines, 20 years ago, they had an X-ray. I do exercise, that's stretching. It's okay. I play basketball before.
You play basketball?
I just stopped last year because of the pain is getting worse.
Okay. So the pain getting worse, and then from 1 to 10, 10 is the worst pain you was with level 4, 5, 5, 6.
I think 7.
7.
If I stand like 10 to
For
15 minutes, the pain is already there in my hip, down my legs.
So like, you go all the way down now.
Yeah.
So one side, both sides, when you go all the way down.
The pain is in my left, and my right is the numbness.
So left side go all the way down to past your knee level, like oh wow.
Yeah,
And then so the right side is numbness.
The numbness. Yeah.
So okay, then you know this is sciatica, right? I think I'm gonna explain to you even more detail. So sciatica, this is sciatic nerve.
Yeah.
Like this, the nerve go all the way down. This is sciatic nerve go all the way down. If you don't fix it, I see some patients feel tingling numbness on the feet. Yeah, so okay, so I'm gonna do some like, so since you like for low back, okay, so don't worry, okay, just here. So lean back, you feel more pain, can you lean back low?
Yeah.
Barely lean back.
Lean back.
Lean back, okay.
Yeah.
How about lean forward, all the way down? Like any pain here? No, not much, right? Lean back, you feel more, right? Okay, and then for the rotation, okay, just do one side. Okay. And then right now, when we say you have like low back pain, 7 out of 10, like did you do anything? Did you go to MD medical doctor? Like did you see this?
He's scared.
He's scared. What?
But I'm thinking.
You're like going for hospital. How can you be scared?
He's scared.
He's
Even
scared.
injection, he's scared.
I tried the compression.
Oh yeah, we tried a lot of things.
So you tried?
Conservative thing.
Okay.
We have the belt and decompression like that. And
Okay.
I think the worst is getting more. And the pain is getting worse.
but when Heimbach told us, he had interest to see you.
Oh, okay.
So
it'll be better. Let me know how you feel because you come in. It's a 7 out of 10. Right now it's like 4, 5. It's a little bit better, but get some improvement, right?
1 to 10, I think. 4.
4, yeah.
Well, my cheek.
So just first time you, yeah,
first time.
yeah, first time you feel a little bit better, right? Yeah, from 7 to 4. So you want to turn around, just move, like yes. Tell me how you feel. A little bit better, right? Yeah, like your friend told me like they all tried the Radial Shockwave. So next time you come here, I'm explaining to even more detail, right? But your wife take the X-ray already, but I'm gonna do all this measurement.